How's everybody doing?
Good.
Good. So thank you very much for that introduction. So I'm going to go on a lot of things today. We're going to talk about a lot of things today. But really, I want this to be an open dialogue. So if you have questions, ask them. We'll go through, and then at the end, we'll have an open time for Q&A as well. So first and foremost, the presentation we're going to go over today is called Revolutionizing Healthcare, Bridging the Gap Between Clinician and Patient. The reason it's so important is because there is a gap that exists between our clinicians and our patients. And trying to find a way to navigate and bridge that gap is one of the most important things we can do as clinicians. So that's what today's presentation is going to be about. But before anything else, who am I? Besides this dashing and debonair young man you see before you. That's right, take a second, drink it in. Yeah, that's okay. So, I was born March 16th, 1987. Team Pisces, yeah, it's our season. Yeah, all the other Pisces in the room, there we go. I was diagnosed with cystic fibrosis at 3 months. Now, the interesting part of this is not that I was very sick as a child, because that is what happens with most kids. The interesting part is that it was actually my mother who diagnosed me. Why, do you ask? Because 37 years ago, they didn't think African Americans could have cystic fibrosis, so no one would test me for it. Now, the reason this is important is not that it's a testament to my mother's resilience and ferocity, but also this rhetoric still exists today. And so that's a problem that we exist, and a problem of the prejudice and how we look at different disease states, which not just is exclusive to CF, but how we will face and shape different things in minority populations. So I was an athlete, all-state in wrestling and stand-out in baseball. So growing up, I was given the same opportunities as my siblings, and I was expected the same of each one of them. We were great, and the expectation was to be great. So college, I went to Bowling Green State University. I got my undergrad in dietetics. I have my master's in food and nutrition. I also did my dietetic internship at BG, so I'm a Falcon through and through. So, and I became a registered dietitian in 2012. So this is going on, do the math, some 13 years. So it's been a while. I've been doing this RD thing for a while. So we got some fun facts. Who doesn't like fun facts? I have a twin sister, her name's Nicole. No, we are nothing alike. She is very kind of type A rigid, and I am much more, I say yes to everything. Free flowing? Yes, of course. When you want to go? Of course, yes. I'm going to be honest. I didn't even know where this was till I emailed somebody today. I was like, where am I supposed to go? Who knew? I just knew I said yes to it. I'm allergic to watermelon. This is interesting because I enjoy when people ask, do you want watermelon? I can say, no, I don't eat watermelon. If you don't understand why that's funny, ask someone else in the room. I love traveling. I'm huge on traveling. I actually, in October, I was in Africa and with my friend. Actually, we went for a friend's wedding. And then I actually just got back from Costa Rica 2 weeks ago. And then in another 2 weeks, I'll be going to Puerto Rico. So for my 18th birthday, I was able to go to Paris, Italy, and Germany. And then again for my 31st birthday, London, Paris. So I have been to 45 of the 50 states. So everyone wants to know which ones I haven't been to. So Hawaii, and then my middle American states, North Dakota, South Dakota, Idaho, and Montana. I was a professional dancer for 12 years. I did hip-hop, lyrical, and expression. I have an extra vertebrae. This is only interesting because it's weird. And we have a saying at my hospital, when something weird happens, Nick happens. Let y'all read that one. So what happened was, it was a beautiful day of Saturday. Me and my cousin were hanging out. It was one of those days, we were like, let's play hide and go seek. So I had this brilliant idea. I'm going to get in there. Boom. I'm in the dryer. I'm hanging in there. The door opens, and I thought my cousin would find me, so I do this cat-like thing. And then a blanket comes in. I'm like, ooh, I'm safe. Wrong. Next thing I know, I get 2.5 rotations in. I know, that extra vertebrae saved me. I got 2.5 rotations in before I had to push open and kind of fall out like a scary movie. And then my auntie screams, and she's like, ah, yelling at me. And I'm like, she was upset that I was in the dryer. And I'm like, I'm upset you started it with me in it. That's just rude. Rude. Needless to say, we were no longer allowed to hide in appliances. I guess, because I had a hell of a spot in the freezer coming up. I was going to be in this boy like this. So those is me in London in my photo booth changing, and then me right in front of the Louvre. So our learning objectives. Basically what we're going to go through today is practical strategies for enhancing communication and accountability. We're going to talk about ways to bridge that gap. We're going to look at ways to communicate and divulge in your minority populations. And we're just going to overall increase mindfulness and also how to channel that passion into effective and productive team building as well as team strategy. So the basics. I know this is not CF, so I want to just give some quick overview of CF, which is part of who I am and what helps make up my story. So the known, it affects the lungs, the pancreas, and the stomach. That's kind of like the general overview. The less known about CF is that it affects everything else. That is, when you sign up for this disease, they don't tell you that. I was in line and I didn't know. I didn't read the fine print. You gotta read the fine print, people. It affects your mental health, your relationships, your daily living. I just want you guys to know that is my favorite part of the whole presentation. Okay? It took me so long to get that little rabbit hole thing to bounce that it's literally my favorite part of the whole presentation. It's the little things in life, people, that bring you joy. That's what you need to find. The little things in life that bring you joy. So, living with chronic disease. The great thing about this and the real thing about this is not exclusive to cystic fibrosis. So, handling medications. I take, on average, 58 medications a day. So between enzymes, just regular pills, nebulized treatments, insulin shots, 58 medications a day. Managing relationships, the talk. Now, everyone has a version of this talk. And for people, it's like, hey, I have cystic fibrosis. That's what we know in the community as the talk, because at that moment, everything changes. When you have to tell someone you have a chronic disease, you immediately see the change. Sometimes it's dramatic, where now every cough, it's like you're dying. Or you have the other side, where you just coughed up 10 liters of blood, and it's like, oh, it's part of the process, you're all right. And then you have the people somewhere in between that you try to find that balance. And that's true with all chronic disease, trying to find people who can find that balance in between. Hospitalizations. Now, this is a big one for me because I spend, on average, a third of my year in the hospital. I'm admitted every 3 months with an average length of stay of 33 days. So yes, I spend a lot of time in the hospital. And future planning. That's really exciting because there is a lot of groundbreaking work that's happening in the CF community that allows for future planning, something that didn't exist. The beauty of this, especially in pediatrics, is we have advancements happening in all forms. So when we have these advancements, it brings us hope, it brings us excitement. That excitement not only translates to our colleagues, but it translates to our patients. So living with chronic disease. This is my survival kit. This is what I think people living with chronic disease all need. Be informed. The more you know about your diagnosis, the better. The more your families know about their diagnosis, the better. Thick skin. Get it and get it quick. The world is not a happy place. It is not a kind place. Adaptable. You have to be flexible. You know, for me, I can go from feeling great to feeling terrible in a matter of an hour, in a matter of minutes. So you have to be able to be adaptable, be flexible. A strong support system. Now, this one is really important because often when we think of support system, we think of our family, our friends. But we rarely think about ourselves as part of that support system. And that's a big thing for your patients, for your families, for their adults. They're caregivers. You are just as big a part of their support system as their blood and their friendships outside of the hospital. Not only are you the most knowledgeable, you're the people they can lean on when they have questions. And find internal passion for external outlets. This is important for me because one of the things I always tell people, and especially when you're talking to clinicians and you're talking to patients, is look at the example of going to the gas station. You go to the gas station to fill up, not for the sole purpose to go to another gas station fill up. You fill up at the gas station so you can go out to the mall, go to the movies, go out with your friends. That's the same mentality we need to have when we're talking about taking medication. No one wants to take medication for the sole purpose of taking more medication. We want our patients to understand they're taking medication so they can go to the movies, go to the mall, go hang out with friends. Does that make sense?
Mm-hmm. Yeah.
All righty. So this is my CF care. Exercise is super important. Avoid the all or nothing mentality. This is going to be really important for patients because often we get that idea of, well, I missed my morning dose, so I'm not going to take my night dose. We'll just start over fresh tomorrow. But you know what's better than 0? 1. And this is important as clinicians because we need to find grace and liberty for our patients. I tell people, are you your best version of yourself every day at work? The answer is no. I know somebody's boss is here. I will ask questions, okay? But in reality, when you clock out, you get to go home and you get to just be you. You might still be a doctor, but you're not actively working. When you have chronic disease, there's no clocking out. There's no checking out. Sometimes having a chronic disease is about navigating and doing the best you can because you don't get days off. Sometimes it's not non-compliant. That's a term that I try to edge people away from because compliancy is a direct informational choice. Non-adherent or not applicable might be a better terminology because we're not really sure. It could be a fact that they want to take control over the only thing they feel they have control over. It could be also an example of they don't have the knowledge to understand why this is important, and they don't have the future sight to see. Or they feel like they're taking medication for the sole point of taking more medication. This is important to realize, and then we can do things to change that mind state. We want to shift that mind state into something that helps them harbor and get a success inside of their medication regimen. And sometimes we need to loosen up a little bit and not be as rigid as clinicians and say, okay, I know the medication is supposed to be taken 2 or 3 times a day, but let's start with 1. And then you'll start to feel better at 1 or you'll start to take it in routine. Now we can add a second dose. Now, yes, it's prescribed 3 times a day, and I understand that's how medication is supposed to be taken. But we also want to be realistic, and we want to promote them feeling their success. So them taking it once a day, even though it's supposed to be a 3-time med, that's a success. Because they could have this all or nothing mentality and take it 0 times a day and keep wanting to restart. Strong mentality. Avoid the who's sicker game. The only thing who wins in the who's sicker game is the disease. So this is the importance of exercise. I'm going to just go over this real quick because this is important for everyone. It's not just CF. It's not just dialysis. It's for everyone. But the one I really want to concentrate on helps concentration. That's a huge one. And then improves mood and releases stress. It also improves sleep if you do it before at night. It will improve your sleep. So my 3P methods. Passion, purpose, productivity. So most of the time, everyone has a definition of what they look at this to be. So I'm going to give you what my definition of this is and how it applies. Passion is that burning desire, item, or trick. It's what that internal fuel is. Now, purpose, everyone looks at purpose differently. But how I look at purpose is it's how passion is displayed. And then productivity increases as a byproduct of finding passion and then utilizing purpose. So what do? We find passion. What is that internal desire? Purpose. That is merely the external display of that passion we found. And productivity is the increase. So many people look at productivity as just a bottom line number, but that doesn't have to be the case. When you are productive, you could produce more smiles. You become happier. And that doesn't just translate when you close the door. It permeates through the rest of your life. So when you're happier in your work, you become happier at home. If you're happier at home, you become happier in your work. Our passion could be for nephrology. Our purpose and how we display that, it might be coming to concerts. Coming to, we can go to the concert. Can't stop, won't stop. So going to events, understanding, networking, coming to sit in, going to conferences. Those are how we externally display our passion, our burning desire. And then that inherently will increase our productivity, how we manage our patients, how we help our patients' outcomes. These are all elements of productivity. Why is this important? What does this look at? Increases patient outcomes. That's number one. That's what we're all striving to do, to increase our patient outcomes, to make it more effective. Satisfied employees, decrease burnout, decrease turnover. When you're having passion and you have passion and then utilize purpose, your colleagues can feel it. You become happier in your workplace. Another important thing is when we're inside of the workplace, finding something you're passionate in. You might find a thing that, hey, I found passion in this project. See if it incorporates with your daily job. Because now you have a level of passion inside of that passion you already have. It allows you to bridge that gap inside of your own workspace. Increased loyalty and alignment with the company, more productivity, helping others make happier. When you help others be happier, that inherently makes you happier. There's a trickle-down effect. So some of my passions. Nutrition, sports nutrition, I love it. It's one of my favorite. Weight management, diabetes. I do have diabetes myself as well. And cystic fibrosis. I kind of fell into that one, I'm not going to lie. I'm not saying it was great, but here we are. And then teaching. So I do business etiquette, success training, public speaking training. And I love public speaking because I love sharing my knowledge. It gives me one of my favorite quotes. A candle does not lose anything lighting another candle. You see that candle effect? Yeah. It's the details. It's the details. So, healthy person's mind state. What is the healthy person's mind state? So first, compliance. Getting rid of that term of non-compliant. That's one. Perception versus reality. Okay? The perception of a situation. Your day versus their day. So when you're chronically ill, say you're chronically in pain. You know what? We'll start from your day. Say you're having a fantastic day. It is, we'll say, an 8.5 out of 10. Now, if you go to a 9.5, are you really going to tell the difference? Probably not. You maybe have more laughs, a couple more smiles, but that'll be. Now, say you're chronically ill and most of your days start at a 4 out of 10. And you tell me, hey, Nick, you have to take your medicine or you won't feel well. But when I take my medicine, I go to a 5. When I don't take my medicine, I go to a 3. Am I really going to feel the difference? Not likely. However, you as the healthy person, if you're at an 8.5 and you become in pain, if you don't take that medication, you go to a 4 and you're able to feel that. That right there is the healthy person mind state. When you're able to step inside of being healthy and see what the transition will be for you, if you don't do something, that would inherently make you feel better versus the medication a chronically ill patient or the treatment a chronically ill patient has to do. So that's when we use the example of no one wants to take medication for the sole purpose of taking more medication. So the selling point can't just be, you have to take your medication, you won't feel good. I already don't feel great. So taking it is going to make me a little bit better versus, but taking it will allow you to do these things. It will allow you to go to the movies, go to the park, go to the ball game. Now this next one, we as clinicians have a terrible habit of doing this. We answer the question or situation that was asked or not presented. We do not answer that. We answer based on what we believe should be answered. I'll give you an example. So we have a 12-year-old girl with cystic fibrosis who has to take enzymes before she eats. She comes in the clinic, she's losing a little bit of weight, she's having GI symptoms. And you ask her, hey, how's your enzyme? She goes, I don't take my enzymes a lot because she eats out a lot with her friends. And she says, I don't want to take my enzymes in front of my friends. Okay. Your reply is, I completely understand what you're saying, and that makes a lot of sense. You don't want to take your enzymes in front of your friends because you feel some kind of way. And that's important to understand, but you also need to know these enzymes are incredibly important. Some of the ways you're feeling is because you're not taking your enzymes. So we really need to have you taking your enzymes to really help your overall health. Now, who here thought that was a good answer? Okay.
I thought it was okay.
Okay, somebody telling the truth. Thank you. Somebody telling the truth. Now, okay. Now, okay. So. All right. Now, it covers active listening. It covers understanding, compassion, empathy, and results. All the things we learn when we're supposed to have a conversation with our patients. However, that's not a good answer. And I'm going to tell you why. Because it doesn't answer the question or the situation that was presented. It is not our job as clinicians to be able to tell our patients when they feel comfortable enough to disclose their illness. So what the answer should have been is, I completely understand what you're saying. And taking your enzymes is really important. And some of the symptoms you're having is because you're not taking your enzymes. So what I suggest is when it's at dinner with your friends, say, hey, I have to go to the bathroom, take a sip of your water, go to the bathroom, and take your enzymes in there. And then come back to the table, now no one knows you had to take your enzymes. Because it's not our job to be able to tell this 12-year-old girl or any patient when they need to disclose their enzymes, when they need to disclose their disease. We need to use our clinician brain, and we need to be able to provide solutions based on the information that we know to be true. That's what we need to do. Does that make sense now? So, and last, empathize with the individual in their situation. Everyone goes through something different. Everyone is faced with a situation that they're stepped into, and now they need to figure out how we can navigate it out. Back with another enzyme example. We have a person who lives in Cleveland, and I forget my enzymes all the time. So legitimately, there's enzymes in everybody's car I get in every purse that I'm around. That way I don't have to forget it. Now, that works in Cleveland because it's not that hot. That same tactic won't work in Arizona because you can't leave them sitting in the car because it'll degrade. So now we have to think of other outside of the box. Now that's me using my clinician information to know it degrades, to now have to think of a solution for them. That's where they come together. That's where you mirror them together. Supporting our patients. Now this is huge. So navigating insurance. That's a lot of times that's going to be the social work, but everyone can help on that. Everyone, because it's a stressor. I like to think of myself as a pretty intellectual guy, and I struggle trying to navigate my insurance all the time. It is hard. assisting with SSI and SSDI. Once again, this is somewhat social work, but everyone can be a part, even if it's navigating them to social work to try to help that, if they can say that's a pressure point. Because as clinicians, you're helping the entire person, not just solely that disease they have. Even though you might specialize in that, taking care of the whole person and their wellness will ultimately take care of the other part. If a person is incredibly stressed, it's hard for their body to heal the way we need it to. DEI, which I know is a hot button term right now, but in our spaces as clinicians, it should never be isolated and it should never be forgotten. Everyone has a preconceived notion. We all have inherent bias. It is what it is. The key to that is recognizing that and figuring out how we can combat that. We want to avoid judgment, avoid our preconceived notions. Ask the questions that we don't know. If you don't know why someone uses the pronouns them and they, and I use that as an example because I was unaware myself. I was confused. I was like, well, this is plural. So, but you are a sole individual. I didn't understand. So I asked. And then they explained it to me. And it goes, well, there's a long history of using them and they talking about individuals. Like, they were in a car accident. Are they okay? Oh, I guess I never realized that. We use it all the time. But until I was able to ask that question and really want to hear the answer, that's the other part. It's one thing to ask the question, it's another to want to hear the answer. And that's the important part. The importance of research. Now, this is important just because we as clinicians are always striving and should always be striving to learn. So that's one element of research. The other element of research is promoting research, helping people feel research, to want to be a part of research. And how does that happen? Because a lot of times there's a lack of representation. People don't see people who look like them in research. People don't see them in the researchers, in their promotional material, or in the conversations they're having. So if I don't feel seen, I don't want to be a part of something where I don't feel seen, because that inherently makes me feel like I won't be heard. So this one is about modulators. So the thing that's important about this one is there's a lot of advancements in cystic fibrosis. I myself am not modulator eligible. The reason I find that important is because people always ask me, how do you feel about it? And the answer is honestly hopeful, because I don't have to watch people I know suffer. I don't have to watch people I know struggle. This is important when you apply to nephrology, because you can create that community. You can create that feeling. Dialysis is not fun. My grandma was on dialysis. I've been spoken to about dialysis. Random Nick fact, I have polycystic kidney disease myself. So I understand that these things are great. They're not awesome. It's not what you want. But if we can create a community around it and say, these are the things we need to do to help us improve, this is what I'm doing. Because patients talk. Are you on this phosphorus binder? Does that help? Oh, what kind of experience have you had with this? How are you struggling? I'm struggling with the potassium. I just want to have a banana so bad and a kiwi so bad. What are you doing? Is banana flavored candy still banana? So these are real questions and real conversations. Creating that community. No, but seriously, is banana flavored like candy? Is that banana? Can we have that? Is that okay?
Heroes don't have chocolate in it, right?
Exactly. That's what I'm saying. I'm asking the hard-hitting questions here today, people. This is what we're focused on. This is why we're here. Banana flavored candy. So, I am more than just a disease. As I mentioned, I was a professional dancer. That was in my younger days. I was able to hold my whole body weight up. Rise Up for a Dream. That's one of my favorite poems that I've ever done. I'm a photographer and a DJ. I'm also an author. I author and co-illustrate. So I have a children's line of books. They're called The Adventures of Miss Messy Susie Magoo. There are currently 2 books out, and the 3rd book is now officially finished. It will be out on my birthday, so in 2 weeks. I am a clothing designer. So yes, those are my apparel, my hat, my shirt. This was actually the first shirt I've ever designed, my double breed. And just to give you a little context, it's crossed out because crossing it out, just because you cross it out doesn't make it easier to do. Oh yeah, we got a little more. Oh yeah, I'm out here in these streets. I just finished my cookbook. It's called No Need for Seconds, high calorie cookbook, but it also is full of comfort food and delicious treats. It has options. It has breakfast, lunch, dinner sides, snacks, desserts, and beverages and soups. So whatever you're in the mood for, this cookbook has. Currently out available on my website, nicholaskellyrd.com, if you're interested, just so you know. So some of my takeaways. The strongest thing anyone has is their mentality. That is the single strongest thing you have, and the single strongest thing that is most important. That is for you, for your patients, for you as clinicians. So much of any illness is about mental. That is no different with CF, dialysis, nephrology, kidney disease, liver disease, our own personal struggles. The mental is where it is. This one right here, it is our responsibility as clinicians to guide our patients to success. It is our responsibility. What our patients need, what they need to succeed, what they need to be able to flourish, what they need to just sometimes be able to get through. It may not just be clinical advice. It might be home advice. It might be life advice. It might be a shoulder to cry on. Each one of these things are what help guide our patients to increase success. As I mentioned, the 3 Ps. Instilling that passion, utilizing that purpose, increases that productivity for you, your colleagues, your team, your patients. Each one of these are an example of what allows you to be better for your patients. It allows us to be better for our patients. Now this one is super impactful for me. CF is no longer a death sentence, with more than half of the population being over 18 years old. It's the first time in history that has happened. So give it up for that. As the median life expectancy is now 56 years old. When I was born, it was 20. So we've come a long way. As a person, myself, born with cystic fibrosis, I had open heart surgery when I was 5 years old. So I spent 6 months in the hospital. So the hospital is something I've known for a long time. I was told I wouldn't make it to 6 months, a year, 2 years, 2.5, 3, 5, 6, 9, 10, 12, 14, and at 16, they just figured they stopped counting the boy out. 36, 37, and now what will be 38 years later. I stand strong, I stand here. As a testament to the support system I've had, as I mentioned. As a testament to being able to be treated like a child growing up and not having to bear the responsibility of my disease. As people who work with peds, that's an important thing because a lot of parents will come to you, what do I need to do for my child? One of the biggest things you can let your parents know what to do for your child is to allow them to be children. Let them go roll around in the dirt and then Purell them afterwards. It is, as I am not a parent, but I have my parents and I was able to experience what they did for me. What did they do? They bared the weight of my disease so I didn't have to shoulder it. Now that's going to be hard for parents. It's going to be stressful. something that happened to me when I was younger is when I was 5 years old, like I said, I had open heart surgery. I spent 6 months in the hospital. But I remember that time very fondly. I remember having toys, having people over every day, really enjoying myself. I still had to do my homework, which sucked, but every other part of it was great. Now, fast forward 30 years later, I was having a conversation with my auntie, and she was just telling me, yes, the same auntie who started the dryer on me. I was having a conversation with her, and she was just telling me how much my parents did for me when I was younger. I was like, well, I know, I've done that. She was like, no, when you're in the hospital, she used to have a checkpoint. People would come to the door, she would tell them something sad, and see how they react. If they cried, they had to wait outside until they could stop crying. So that way, I never saw anyone cry. Everyone was happy when they entered my room. What I didn't know is they spent every day crying themselves. But I never had to bear that weight. I never felt that. My parents did. That can be hard. That can be strenuous. I can only imagine. But that was something I never knew. Because as a child, like I said, all I remember is people being happy in my room. I remember it very fondly. And I said I was in from right before Halloween all the way to after my birthday in March. I think fondly on those. Why? Because they bared the weight of that disease for me. And as working with peds, and like I said, I know parents will ask you, what can I do to help my child? You can do the hard thing and not make your child have to carry the weight of their own disease. This is true about so many chronic diseases. Chronic disease makes you a survivor, not a victim. As you grind through what your chronic disease is, like I said, for me, it's cystic fibrosis, diabetes, polycystic kidney disease, liver disease, chronic GI disorder. You pick an organ, something's wrong with it. But that's what drives me. That's what allows me to navigate through. Because I am a survivor, I am a fighter. I am not a victim. I'm not a victim of my circumstance, and I will never allow someone to make me feel like I'm a victim of my circumstance. That is what has allowed me to thrive despite my disease. One thing that someone taught me that was very important is, Nick, you have CF. CF does not have you. That is something that resonates and you can disseminate to your patients. You have kidney disease. Kidney disease does not have you. Kidney disease does not have to define who you are. It's merely a part of your story. CF does not define who I am. It has helped shape me into the person I've become, but it's not who I am. It has not defined who I am. It is not the sole thing I am. As I mentioned, I am so much more than my disease. And that's something we want to instill in our patients now as peds, so they grow up knowing that they can be so much more than that dialysis chair they sit in. So with that in mind, I want to take a second and we'll open it up for questions. So we'll start.
I have a question with diets. A lot of times we'll have a child and they can't eat X or they can't eat Y or they're supposed to have less of it. And I always picture them going home and the rest of the family eating everything that kid wants, then them having something else. How much of a diet with chronic disease should be done at the family level rather than the kid level?
The majority of it. So growing up, I had what was original my 13 and 21 food allergies. And for my first year, I had my original 13. I avoided all 13 food allergies. It was brutal. I did learn how to cook everything from scratch. There was a time I could read every food label, and I can tell you exactly what the first 5 ingredients were. It was a nice little parlor trick I would win at the grocery store. Be like, all righty, give me that package. All righty, let me go. We got corn syrup. We got this. We got that. Give me my $5, please. Thank you. But it has to be done at a family level, but this is another example of the family having to wear the weight of the disease. Now, it doesn't mean they have to be exclusive, Because also it's a great learning lesson that, as said, be adaptable. Life is not fair. So you have to also instill that and learn. You know, one of the things growing up that was really obvious for me is I had to take my medication, I had to take my treatments. We're talking about over an hour of nebulized therapy. But I didn't think it different. All I thought of it as something in my normal routine. So you wake up, you brush your teeth, you wash your face, you eat. I wake up, I brush my teeth, I wash my face, I take my treatment, I eat. It was just something else incorporated into my daily life. It was just one thing that was incorporated into what I do. And so when it came to my food allergies, the house, very similar, we were close in meals. But when I had all these food allergies, we had to figure out how to pivot. Because my mom doesn't really cook. It was my dad who did the cooking. My mom can cook, she just doesn't cook. Strong difference. So we would have meals that would be, say it would be mashed potatoes, corn, and chicken. I would get chicken, no corn, no mashed, and we just substitute with rice. And eventually, instead of the mashed potatoes, we would just have the chicken and rice. And then instead of corn, I would get peas. Or I would just get chicken and rice. And I would get double helpings of rice. So we were able to balance that out. And that's what becomes important when you're having these conversations. Allow them to balance it out. Mealtime to balance out. Or make it fun. Have them a part of the experience. And so say everyone has this meal over here that they want to eat. Have them part of the cooking experience so they don't have to feel left out because they're not eating that. That's another example of how to incorporate them into the fold. Does that make sense?
Thank you.
No problem. Any other questions? No other questions. Okay, I was about to say, I'll start asking myself questions.
I was wondering, because my background, I did med food, so like I did training for both like adults and kids, and a lot of issues that come up, especially with chronic disease, and I'm thinking about my little sister with this, is like transitioning from the ped side over to the adult side, and I wondered if you could kind of speak to your experience about like how it went overall, and maybe ways we could like make it better and kind of like shepherd our patients over to the adult side.
Okay, so the question is how the transition between peds to adults. So I'm going to give you two parts. The first part is my transition, I can't really count. This is why. So in my center, we had a doctor, Dr. Stern. Stern Almighty is what we call him. The man, the myth, the legend. He knows more about CF. He actually helped write the book on modern CF care. The literal book, I mean, like not the hyper, like he helped write the literal book. And so I saw him as my doctor. I saw him as my inpatient in the hospital. So he carried me all the way until I was like 26 or something like that. And then he basically retired because that man's going to die in that hospital. I promise you. He's got a cot in the bottom, I'm sure. So, but I transitioned to just another doctor because I was ready to transition to a new doctor. So that was a little different from most people's transition. And then my transition from the hospital, from the peds floor to the adult floor, is I got kicked out of the peds floor. So I had no place to go. So, and that's a whole other story for a much different time. But, so my transition was different. But being a part of actively helping other people transition, the thing that I know and the thing that is most prevalent is starting them early and helping them meet the different people a part of their team with someone they already trust. So the transition I had from my current doctor to the doctor I had previously, my previous doctor I was very close with. We were extremely close. We had a very, very tight bond. When she told me she was leaving, I was heartbroken. I don't like change, and I really liked her. But she gave me the approval, this is a good doctor. She ushered me into his care. So I felt more confident that a person I greatly trusted told me, this is the person you need to be with. This is the person you're going to be with, and I trust them. Give them a chance. that allowed the transition to be much easier. So that'll help your transition where your patients are going from their peds to adults. Be the conduit to transition them. They trust you. They built a rapport with you. And start that process earlier. Let them know, hey, we know transition. You're a little ways away, but let me help meet you to the people you're going to work with. Have them sit in on one of the sessions. And I know everyone's busy. They can't sit on everyone's sessions, everyone's whole clinic appointments. That's not what I'm saying. What I'm saying is they can pop their head in and go, hey, I'm Casey. Nice to meet you. I'll be the dietitian. I'm a dietitian on the adult side. I've heard so many good things about you. Okay, well, it's nice to meet you, Casey. Back out we go. Team dietitian, that's what I usually do. Team dietitian. So those are the important things because that'll really help the transition process. The earlier you get in and you start introducing it to the people they'll get to know who will be part of their further care, and cannot stress this enough, let them know that when they transition from peds to adults, they don't lose you. That's a huge thing because that's one of the big fears. Now, yes, will you no longer be their pivot point of contact, but it's going to be initially, they're going to want to ask you some questions because they know you. Don't let them know like, hey, here you go, cut the cord, deuces. Like, that's not what you want them to know. You want them to know that you're still there. You're still in the clinic, but you're allowing this care to happen because this is not where you specialize in. And let them know, I want to be able to be as good for my other patients as I was for you. Because that's going to really help them because they feel like they're just going to get the cord cut. And now they're going to be with this new person, this new environment, this entirely new system, and they've built this rapport and trust. No one wants to start over. So that's where you're going to be really important to help that transition. Yeah, no problem. Any more questions? Yes.
I have one I've been thinking about. This is an example of one of my patients, and I'm kind of curious to hear your thoughts. She's 15 years old, on chronic dialysis, peritoneal dialysis, so has a lot of different medications she takes. As her medical team, as her doctor, I've been concerned. I think I see signs that she's not taking all of her medicines, but she says she is. And my gut feeling to this was the way she was so adamant about, no, I'm taking my meds, no matter what you say, I'm doing it, is to let her have that. I just don't know that it was a lot of point to really push that. But then I wonder what your thoughts are about that, or what other ways I can help with motivation around taking meds and importance. Does it go back to the what you're saying? It'll help you do the things that you want to do in life.
Okay.
Yeah.
So the thing about this is, and yes, we want to give that to them until we can't give it to them anymore. We want to allow them the benefit of the doubt, the BOD, as long as we can. Because then that builds that you trust them. And that's a huge part. I want to know that my clinicians believe in me the same way they want me to believe in them. So if they're saying they're taking it and there's no strong evidence that they're not, or there's nothing you caught them up in, because some people get the lying and they catch them up and it's like, oh yeah, I take them every 2 o'clock on Thursday, and it's Thursday, and it's like, have you taken it? Oh, I usually take it on Wednesdays. Wait, you just said you take it on Thursdays. Okay, unless you start feeling those things, allow them to want to believe them. Let's not think so jaded of them. Now, we know a lot of patients may not be taking them, and they say they will. But we also need to find creative ways, to see if they're taking them inside of their routine. And this is one of the things, for example, what does your days look like? I get up, I take my meds. Like if they initially prompt it because it becomes part of their daily routine. If in no place they say taking meds, maybe they're not doing it. Or maybe if someone asks me, Nick, how do you take your meds? What do you mean? Like you got a system? And then ask them, hey, I have another patient we're trying to figure out a good system. What's your system for taking your meds? And I'll tell you. I keep a bag. Dave will tell you. I keep a bag, and I dump it out on the bed, and I just start pouring pills in my hand. Everywhere I go. I keep the same duffel bag. It has all my pills in it. I don't like the pill cups. I don't like that because then I have to separate them out and take them again. That feels like one extra step. So I take the bag, and I dump them out. That's how I do. And I have all of them here, and then when I put them in my hand, I can see, okay, I'm missing a blue pill, a big blue pill. So I can tell you that, okay, I'm either out of it or I haven't grabbed it out of my palate. So when I'm looking at meds, you tell me what meds I take, I literally, you'll see me look in my hand, like when I'm trying to remember, so I can remember what's in my hand. So, when I'm at the doctor's like, what meds are you on? And it looks like I'm just reading my hand. It's because I'm visualizing the pills that are in my hand. So that's another creative way to ask, what's your process? I have another patient trying to do, and if they can't tell you any functional process, I just take them. Okay. Now, some people will do that because they're teens, but so it doesn't automatically mean they're not. But you start getting creative, and now we found ways to instill so we don't feel like we're lacking confidence. You're empowering them to want to know what they're doing. Say, you know what? You do such a good job. Could you tell me your process? That way I can give it to another patient. And now they feel like you're empowering them, and they're becoming an example versus degrading them and feel like they're not taking it. So those are two ways to be creative in finding out their process, seeing what their process is and seeing how they take it. Like I said, for me, the pill, and then I get up, what's my daily routine? I started really with my meds. And even I take them at night. And at night's a little harder because I'd be laying down and I don't feel like it. I didn't feel like it last night. And Dave was like, you need to get up and take your meds. And I was like, okay, fine, I'll get up and take them.
Good job.
And I did. I took them. Sometimes you need a little motivation. It's a lot of meds. But that's the thing. Or who motivates you to take your meds? Do you have anyone who motivates you? I'm trying to figure out the best way. See? Each one of those things, like, how does it work? How does it play? I make games out of taking my meds. Sometimes I use them like taking my enzyme like a ninja. Like, so no one can see me take them. Like, do. No one saw me take them. I love it. So each one of those things becomes a way to imply and implicitly put in information. So you can take out information, you put in the information.
Thank you.
No problem. Any more questions? Going once. Going twice. We have no questions. Okay. So for me, just understanding one of the big and important things is we have our patients, we are clinicians. The gap exists because there is a communication gap. The gap exists because inside of the way our healthcare system is, inside of the communication, and inside of the evolving landscape of health, these gaps exist. It is our job as clinicians to bridge that gap and bring them closer. Even if it's sometimes meeting the patients where they are. That's where it's our responsibility to help bridge that gap, to ultimately build success, build health, build well-being for our patients. And so this is all my contact information. If anyone ever needs anything, you think of any questions or you need anything from me. And then it's cutting off the bottom, but my website is nicholaskellyrd.com. So the same as all of that, just put .com. So each one of those is just add .com to it. That's where my cookbook is and some of my other things. And like I said, I'm always available for questions. I'm all available for comments. I'm all available for speaking, whatever it might be. So.
Thank you.
What's your top going to be tomorrow with the kids? What is your top going to be tomorrow with the kids?
My talk tomorrow with the kids is just going to be something similar to I did it and so can you. But really understanding